Hi there, I'm Dr. Guy Carnazza, and I practice in the town of East Rockaway, New York. And today I'd like to welcome you to Discover What's Possible. I'd like to share a case with you that we recently completed of a patient who presented to us, 64-year-old lady, who her chief complaint was that her front tooth has broken off. And actually her front tooth had broken off quite a few times. And she was actually reinserting the tooth herself. It was an implant-supported crown that she was able to fit back into her mouth. And upon further examination, we revealed why this tooth kept popping out. And we were not able to determine if we could really just put this one tooth back in and let that be the final solution. And when we looked at her mouth and examined it more closely, we noticed that her bite had completely collapsed. And what we had to do was reconstruct both her upper and lower arch. And this was due to the fact that she was grinding her teeth back and forth. So let's share with you today how we did this. As you can see in these photos, the patient's bite goes up and down like a roller coaster because she's grinding her teeth away, grinding them away so much that she's grinding right through the tooth structure and not allowing much room for the new teeth, for the existing teeth to function together. She was grinding right through the enamel of her upper and lower teeth and grinding through the porcelain of her existing restorations. So when we examined her even more closely, we could see that there wasn't much room for her to close with. She was actually over-closing and in the process breaking off that front tooth. So what we had to do was actually open her bite to create room for material so we could rebuild her bite properly. We call this opening the vertical dimension of occlusion, or opening her vertical dimension of bite. And there's a lot of patients out there who suffer from teeth grinding, collapsed bite, and broken teeth. And I'm here to let you know that we can help you with this. I can help you with this. So let's talk more about what we did here. We actually had to crown each of her teeth to allow us more room. By crowning the teeth, we're able to open up the bite even more to create room for the new material and then balance her bite, which gave us more freedom for her to move, close, and chew. With her current bite, she was overclosed and clamping down on her other teeth and just wearing them away. So with a combination of porcelain to metal crowns and all zirconia crowns, we were able to dramatically open the bite, improve the function of her bite, and improve the aesthetics. Due to the extensive loss of gum tissue and bone tissue, we even had to replace some of the soft tissues with pink porcelain so our teeth would look symmetrical and our smile would be balanced. So in the end, the patient was much happier with her smile because she had improved function. She didn't have to worry about that front tooth breaking off anymore. And she was able to smile with confidence. And as you can see in this final photo, she was very happy with the end result. So that's Discover What's Possible. If you'd like to learn more about full mouth rehabilitation and reconstruction, you can visit us on the internet at carnazzadental.com. Or if you're in the East Rockaway area and you'd like to come in for a consult, you can call us at 516-887-3550. We're in the East Rockaway neighborhood. We're only 20 minutes from JFK International Airport. So we'd like to welcome you and like to say thank you. And this has been Discover What's Possible. And we'll talk to you soon.